We have a very special guest today. Dr. Anna Steve is a plastic surgeon at Neinstein Plastic Surgery. Dr. Anna focuses on optimizing women's sense of self and femininity through sophisticated breast surgery. Today, we're going to talk a bit about her journey, how she got where she is today, and also what inspires her about breast surgery and how it's purpose-driven care to each patient. Her work with women's empowerment and self is just so inspiring, and I can't wait for you to take a listen. Well, thank you so much for joining us. I'm so excited to talk with you.
I'm excited also.
Mm. One of the first questions I always like to ask, because it helps our listeners kind of get a better idea about you and your journey, is to just start from the beginning. I'm so curious if you always knew that you wanted to become a plastic surgeon, or if it's something that you sort of discovered along the way.
I'm definitely one that discovered along the way. I would have thought actually that I would be squeamish in surgery.
Mhm.
But as I pursued a career in medicine and explored a little bit of each part of medicine and what I liked and didn't like, I found plastic surgery to be just absolutely amazing.
Love it. I love it. So, how did you get here? What's your journey been like so far?
So I think starting from the beginning, um, I was interested in a career in medicine when I was reaching the stage when I was about to start thinking about university. Grey's Anatomy was a big show, and I thought it was the coolest thing ever. And um, it really actually was probably one of the primary things that inspired me to pursue a career in medicine, which is a little bit funny because, it's a dramatized version of medicine for sure. But once I entered the field of medicine, plastic surgery is a thing that really struck me as unique in the surgical field. It's one of the only fields that's reconstructive and restorative. So I really liked surgery, but surgery is often a where you're taking something away or actually downgrading function or removing something that doesn't work. And plastic surgery is very different in that it's building things back, it's putting things back together, and really restoring form, function, and aesthetics.
Absolutely. Absolutely. Now, your background's so interesting because you grew up in such a small town, right? Was it
Mhm.
600 people?
Yeah,
Yeah.
yes, very small town in Canada.
Yeah, so I'm curious about those early experiences and how that shaped you because so many people, growing up in small towns or just those early stages in their lives, I mean, it can really impact your career. So did those experiences shape your maybe approach to care or your career?
Yeah, I think always the way that you grow up shapes a part of who you become. And for me, growing up in a small town gave me the chance to have opportunity actually. There wasn't a lot of people in our school who wanted to do sports or play activities or participate in clubs. So I got to do all of the things. And so I really found that I had the opportunity to do everything that I ever wanted to do because there wasn't a lot of people who were necessarily interested in being on the teams and that sort of thing. So I never felt like I had to have my one thing from the beginning. And growing up in a small town, especially where I grew up, it was the type of place where everyone knew one another. So it was a very small community. And I feel like in many ways, I've joined a practice. It's also kind of like a small community. And we think of our patients that way. And we think of our colleagues that way as all sort of a part of our community. And I think it's something that comes from way back um, where I was raised, that's very familiar to me. Um, and and something that I've maintained throughout my early years of my career.
Absolutely. Absolutely. Now, your focus specifically is breast surgery. So I'm curious just about your approach to that, and talk to us a little bit about why you decided to focus on breast as really your specialty.
Yeah, I think as the only female surgeon in our practice, it does come a little bit naturally that I focus on the breast part of our practice, because I have a lot of female patients who really like the option to see a female plastic surgeon. I feel like I can relate to my female patients fairly well because I've gone through a lot of similar life changes as they have. Um, and in terms of my focus, I do think the more you do the same thing every day and the same types of procedures, the more expertise you gain in that area. And I would say it's my practice is a little bit unique in that I focus on breast enhancements, including implant based enhancements, but within that realm, I focus on smaller volume breast augmentations and small implants. So even though we're making changes where we're adding implants, we're usually making fairly small volume changes, and it's in many cases more of a restorative practice for moms who've lost a little bit of volume and structure and shape during pregnancy. And then I see a lot of patients from either um, the extremes of the coast, East Coast, West Coast, or like Miami, California, or Texas, who don't necessarily trend to the higher volume implants that are more common where they're from, or patients who have had larger volume implants placed at a different life stage that they feel no longer serve them the way that they once did. And I'm doing a lot of what I like to call restyling rather than revising, but restyling implants and exchanging large implants for small implants, and then sort of lifting the breast up and supporting things in place with what we call the internal bra.
So, I'm curious too. You've talked about on your website and in different instances about this minimal scar approach. Can you tell us what that means and just sort of go into the importance of it, maybe just your philosophy as a surgeon?
Yeah, so I think anytime patients have surgery, one of the things that they're most concerned about is scar. Unfortunately, we can't do surgery without scar, but we can both minimize scar and optimize scar. So for breast augmentation, we like to use a small incision. Our newer implant technology allows us to make smaller incisions than ever before. So we recently welcomed what are called Motiva implants to the US, and those implants are designed in a way that can be placed with a slightly smaller incision based on um, the implant the implant technology. And then when we do have operations that involve larger scar burden, like breast lift or breast reduction, we really focus on optimizing the outcomes. So we take scar therapy very seriously. We use a special wound closure device that goes on at the time of surgery, and that helps start that scar treatment right from the time of the initial operation. And then that special wound closure device called Bridget starts the scar optimization and then is replaced typically by a combination of a scar gel and a scar strip that we have patients wear for the first year after surgery. Um, we also have all the highest quality lasers and occasionally use some injectable type medications to optimize stubborn scars along the way. Um, but certainly surgery can't be done without scars, but they can be minimized and optimized in all cases that we do.
Absolutely. Now, one of my favorite actresses who talked a lot about her breast reduction surgery, Ariel Winter from Modern Family. She talked about, this emotional side to it too, and the psychological side to it too, and how, we talk about surgeries all the time, but for women, this relationship with their breasts, right? That plays a big role in it. So, want to ask you a bit about your just, one strategies as it comes to supporting, your patients and creating this calm environment, but also, part of this whole journey is not just the physical, it's the emotional, right? So how do you balance that when you're thinking about your own patient care?
Yeah, I think for many patients, it is an emotional journey, and they've often gone through a part of that emotional journey before they even come to us. So many women have an emotional journey as it relates to dramatic changes that they see in their breast size and shape. And that can come from weight gain and weight loss, it can come from pregnancy, it can come from breastfeeding, it can come from age related changes, it can come from menopause. There are many life changes that women go through that also causes significant changes to the breast. And everyone experiences the emotions of those differently. For sure, surgery itself, not just, the aesthetics of your breast, is an emotional journey. And I think time spent with patients is the most important thing because each patient is unique and each patient's experience is unique. Um, and it's important to be able to explore that with them and meet them where they are, both before surgery and after surgery.
Mhm. Absolutely, because it is, and before we started recording here, I mean, I even talked about how so many more people are just learning about this space. I mean, of course, there's the botched, TV show, and there's more people opening up about these experiences, right? And the connection when you do have any sort of breast reduction, surgery. So many different, layers to that. But now I want to sort of pivot a bit and ask more about you, right? You are a mom, you're a wife, you talk about all your fitness, right? I'm just so curious, and I know a lot of people are too. How do you manage all these things, right? How do you manage this, professional life that you've built as this amazing doctor and also just your own personal life, right? In this demanding space. I'm so curious if you can talk to us a bit about that.
Yeah, well, one of my favorite quotes is we all have the same amount of hours in a day. So you just have to learn to use them wisely. I'm very grateful to have lots of help to be where I am, but balance is always challenging. And I think if you have a successful career and a family life, it always to some degree feels like the balance could tip at any moment. And you just have to be aware of that all the time. You take the moments that you have to spend with your kids, and make them high quality moments. You take the moments that you have to exercise and you're efficient about your exercise. I try and do things in a way, if I'm going to be doing things for myself or as what I see for myself, like exercise, I try and do that at a time when my kids aren't awake anyway and is before my workday starts. So it's not taking time away from either my career or my family life, but it's dedicating some time to do something that I know is important for me. And it's all a balance. My kids are starting to get old enough that once, if they feel the balance is tipped, they tell me. They say, "Why didn't I see you yesterday,
Mhm.
Mama?" And so, then you adjust a little bit as needed. If I get the sense they need to see more of me, we adjust a little bit. And, maybe it's about taking time on the weekend when my husband and I are both home to do something with the kids that's one on one. And then they feel a little bit that they've done something extra special. There's all sorts of ways you can make it work. But it's a little bit about mindset.
Mhm. Absolutely. The mindset's huge. You're making sure that, you're taking the time for yourself. So many people, say that, oh, I didn't have time to do this or exercise or, do something that I really wanted to do, but taking the time to do that for yourself, I mean, is
Mm.
just so important. Um, we had a lot of young women reach out, and anytime we do these episodes, we have people submit questions. And the recurring question came about this term just of advice, right? So many young women are curious about you in this medical field, in this space. What advice do you have for young women that are interested in getting into surgery, getting, interested in medicine, plastic surgery? They're curious about what your feedback is and maybe if you had any mentors in your life that helped you or what sort of advice can you give them?
I certainly would not be where I am today without mentorship. I think medicine is very much a field of mentorship, and I like to be able to pay that forward. So I always love to mentor other young women who are interested. I'm very grateful that I love what I do. Um, and I would recommend it to anyone. You have to love it and be passionate about it to do it. And I think that's true of any career. So I think it's just important to be true to yourself. Don't do something for external, value. You have to truly love it. And if you love it, then it becomes less like work. You spend the majority of your life at work, so you should choose something that you love and enjoy. Um, I used to like to ask people who were decades ahead of me in their career, if they were at my stage, what advice they would give to me, and also ask them, is there anything they would have done differently? And what I found about most people in plastic surgery is it is truly a career where many people are very passionate about what they do. And I found that inspiring that at the end of their careers, people were still inspired by the work and still excited about it. And I don't think that's necessarily true of every profession. Um, but certainly, I think people who choose plastic surgery are often very passionate about it and feel very lucky to be able to do what they do and touch people's lives in the way that they do.
Mhm. Absolutely, absolutely. The other question that was submitted, and I'm curious about this too. It has to do with just beauty standards, right? Somebody said, in this society that we live in, ever evolving beauty standards, social media, all the things. How do you guide and support your patients, right? In this balance of their personal goals, but also maybe navigating any societal pressures that are out there?
I mean, I think it's very much the same in the sense that like you have to choose it for you. If you're having plastic surgery, you have to choose it for you. And so I think plastic surgery is best done from a place of confidence. And most patients, it's a decision that they don't take lightly. It comes with lots of thought and deliberation. And I do think it's best done from a place of confidence. A lot of people feel like um, there's areas of their body that are frustrating that they can't necessarily change through diet and lifestyle. And there's a lot of women who go through the changes of breastfeeding and pregnancy or menopause or weight loss and weight gain, where on the other end of that life change, they feel like they don't recognize themselves anymore. And so sometimes it's less so a matter of changing their, beauty standard and more so restoring where they came from. Um, and I think everyone's idea of their own beauty standard is a little bit different. And so I try to explore that with patients, and I have them bring photos of what they do and don't like the look of. And then we go through those photos, and if there's consistency in those photos and what they sort of aspire to, the discussion becomes a bit easier. If there's inconsistency in those photos and they like a lot of different types of sizes and shapes and that sort of thing, then we explore what they do and don't like the look of. And sometimes that discussion becomes a little bit of a discussion that relates to realistic expectations and whether or not we can get them to their ideal. But I think the bottom line is it always has to be done for you and not for anybody else, if you're going to have a successful experience with plastic surgery.
Absolutely. Absolutely. Now, my favorite question to ask, and we've gotten lots of really unique responses to this. Some people are sometimes unsure how to answer, and some people are like full throttle. So I'm really curious about your response. All this podcast is all about, highlighting women, helping women understand how people got where they are, and right, building out, inspiration. And this question relates to unleashing your inner queen. So, what does unleashing your inner queen mean to you? And then along with that, how do you unleash your own inner queen?
I think for me, I've always tried to strive to be the best at what I'm doing. So I'm always trying to find ways to improve myself and take things to the next level. Um, and I was inspired by plastic surgery. And plastic surgery is one of the most competitive fields in medicine to get into. It's very
Mm.
difficult to become a plastic surgeon. And I said to my brother, who was in med school at the time, I think I want to be a plastic surgeon. And he said, Of course you do. And I said, No, like I'm not just trying to be the best thing. Like that's what I really like and what I really enjoy. And I had to revisit it a couple times to make sure that I was being true to myself and I wasn't just trying to do the what I perceive to be the most difficult thing. But I think being able to unleash your inner queen, as you say it, to me means always like striving to be better and never settling. And while I was trying to explore if plastic surgery was in fact the right thing for me, I revisited that a lot of times. But while I was considering other options, I was always doing the research that I needed to do to make me a good candidate to apply for plastic surgery, and always kind of doing all of the things. There's a mentor that I have in plastic surgery that always says, you know, sometimes you just get involved to be involved. Like you just do
Mhm.
all of the things just to keep, moving forward and keep adding to your skill set and keep constantly changing. And that's what it means to me is um, life isn't about staying stagnant. It's
Mhm.
about constant change and constant improvement and always getting better. And I think the minute you feel that you're settled and you stop evolving, you start to sort of lose touch and become outdated and forget to innovate. And you know, people say lifelong learning is really a big part of medicine, and that you're always learning and always improving. And as technology changes, you're always kind of living that um, lifestyle of trying to be better with each new day.
Mhm. Absolutely. Absolutely. Oh, that's so wonderful. I mean, thank you so much for one joining us and sharing all your expertise and insight, but also for all the work that you do to empower women. And we'll include any links to your Instagram and the website so people can learn more about you and read more about you. But we're so appreciative of your time and just everything that you're doing.
Of course, we'll always love inspiring as well as working with other women.